Hi, my name is Nilesh Parmar. I am the principal dentist here at Parmar Dental. I primarily work with implant patients and severely compromised dentitions. First of all, we need to look at why are they having implants in the first place. A lot of them, it's because they've lost their teeth due to periodontal gum disease. Now, if that is the case, oral hygiene for the maintenance of the implants is very, very important. If we look at bigger implant reconstructions, these are quite large plastic or ceramic units in the mouth, which by their very nature are difficult to clean because they have plenty of nooks and crannies within them. We tried to make the implant reconstructions exceptionally cleansable, but having an efficient oral hygiene care regime and a strong toothbrush, something which uses vibrations or ultrasonic vibrations which can actually penetrate deeper than the bristles of the toothbrush, is important for implant cases. So it's a team approach. My hygienist, the hygiene team, very, very important. My nurses, the patients obviously, and myself. The way we do this is actually educating the patients and explaining to them, just because they've had the implant work done doesn't mean the implants are immune to gum disease. They still need to look after their reconstructions. So we're teaching them how to brush their teeth, how important it is to brush their teeth, using air flossers, water flossers, ultrasonic toothbrushes, fluoride toothpaste, and interdental brushes as well. We also need to push forward the point that they need to see us on a regular basis and also see the hygiene team on a regular basis. It's lifelong care for reconstruction that is replacing a previous part of their anatomy. So we try and put things into perspective for them. For my patients, pre and post, the oral hygiene regimes will differ. If patients have just lost one or two teeth and they already have very good oral hygiene, then there's not as much work for us to do. It's more monitoring and reinforcing the oral hygiene. For other patients who have got periodontal gum disease or who come with substandard oral hygiene, we really do need to work with them. So for them, their pre and post oral hygiene regimes are much more vigorous than the ones who come to us with already exhibiting good oral hygiene. For example, they would have periodontal gum treatment with our hygiene team prior to implant placement. Then they would be monitored whilst the implants are healing, and then they would have further periodontal gum treatment after the implant reconstructions have been fitted, so we can show them how to clean around these new teeth that they have, because cleaning around implants can somewhat be different to when you clean around your own teeth. My gold standard for oral hygiene for my implant patients is to use an electric toothbrush, an ultrasonic toothbrush such as the Philips Sonicare range, using fluoride toothpaste, interdental brushes, super floss if they've got big implant reconstructions, and monitoring. For so many implant patients, they have the work done and they think that's it, I don't need to come back to the dentist. But it's so important to come back and see the dentist and also our hygiene team, because we need to keep an eye on these things. Implants, when they go wrong, or when a disease process starts around a dental implant, it goes slowly and painlessly. So patients can have peri-implant disease and not know that they have it, because the only real symptom they can have is a little bit of bleeding. So that's why they need to be monitored carefully so that we can pick up on these things before the disease process goes too far.